After washing your hands with a standardized surgical technique, it's time for your gown and gloves. Reach for the gown pack, remove the first towel, hold it away from the body and dry the hands, concentrating on the area between the fingers. Then dab one arm dry, without wiping, down towards the elbow. With the second towel, dry again between the fingers and then dab down the other arm towards the elbow to dry the drips. Open the gown pack, hold it away from you and slide into the arms. Keep the arms in the sleeves, bunching up the fists to prevent the hands from coming out of the sleeve. The assistant can then tie the gown. Open the glove pack so that it turns with the fingers pointing towards you, keeping the hands in the sleeve. Take the left-hand glove, place it back up the arm, and then, gripping it from within the sleeve between thumb and fingers, peel back the glove so that it comes over the hand and allows the fingers to emerge from the sleeve into the finger holes of the glove. Repeat the same with the other side. This side is much easier, and you can pull the gown down as you pass the fingers into the glove. Then don the outer pair of gloves, which are your standard glove size. Double gloving is becoming increasingly common. Select a glove size half a size larger than your usual, and don these first. In the gloves we're using here, the inner glove is a different colour to the outer pair and acts as a marker if the integrity of the outer pair is breached. Finally, pass the sterile tab to your assistant, who will pass it around you, and you can then tie a bow at the side. Glove perforations may be too small to be seen with the naked eye. However, when fluid penetrates to the inner glove, the different colour flashes up as a clear marker that the outer glove has been perforated. At the end of the procedure, gown and gloves have to be removed. Oh dear. That procedure is not recommended, as it leads to contamination of the surgeon's hands and clothing with the bodily fluids from the patient and sets up aerosols. Instead, allow an assistant or the anaesthetist to undo the ties. Take the upper gown, bring it down, rolling the gown into a ball with the outer surface inside. Keep the hands in the gloves till the very last moment, and then peel them off with the sleeves so the gloves turn inside out. Then drop, not toss, the resulting ball into the bin. If another person is unscrubbing, they can assist with gown and glove removal. Tying off a blood vessel is probably the first task your consultant will ask you to demonstrate in theatre, so do it perfectly. A reef knot consists of alternating coming down and going up throws. The shorter end is going away from us, so we tie the coming down throw first, as seen here, bringing the green end under the yellow, and then securing and snugging down by pulling the green end towards and the yellow end away. It is essential in a reef knot that your hands cross with each throw, and that alternately a coming down and a going up throw are tied. Here is the going up throw being tied, and this time the green end of the suture is taken away from you as you tie it down. Put down the cord and just watch. Take the short end which is going away from you in the following way. With the palm down and the fingers towards you, pick up the short end between thumb and ring fingers. If you pick it up exactly this way, the throw becomes much easier. Rotate the hand so the index and middle fingers go under the short end, which now passes down your hand. The next critical move is to separate the index and middle fingers from the rest. With the other hand, pass the long end over the middle and index fingers of the left hand, so forming a loop. Now bend the left middle finger and then straighten it so that you can feel the short end on the back of the middle finger, and it can be trapped by the index finger. Once trapped, it can be released by the thumb and ring fingers and pulled through and laid correctly and snugged down by pulling the short end towards you and the long end away. This time, pick up the cord correctly and follow each move. Take the short end which is going away from you in the following way. With the palm down, fingers pointing towards you, pick up the short end between thumb and ring fingers. Rotate the hand so the index and middle fingers go under the short end, which now passes down your hand. Faculty will now check you have this exact position. The next critical move is to separate the index and middle fingers from the rest. With the other hand, pick up the long end and pass it upwards over the index and middle fingers of the left hand, forming the loop. Now bend the left middle finger over the long end, under the short end, and then straighten it so that you feel the short end on the back of your middle finger, and it can be trapped by the index finger. Once trapped, it can be released by the thumb and ring fingers and pulled through and laid correctly, and snugged down by pulling the short end towards you and the long end away. We now need to change the position of the short end so that it is held in the index finger and thumb, with the thread or cord passing up the hand. We finished the coming down throw like this, with the cord going up the hand being held in the thumb and index finger. Separate the thumb and index fingers from the other fingers. Now turn the hand palm up, and with the right hand, pass the long end down the hand over the middle to little fingers. Faculty will check that you have this exact position. Bend the middle finger so that it passes over the long end and under the short end, and feel the cord on the back of the middle finger. When you straighten the middle finger, you can trap the cord between middle and ring fingers and use them to pull the short end through as you release it with the thumb and index fingers. Lay the throw correctly and snug it down with the short end pulled up and the long end down. And you now see the typical figure of 8 of a correctly thrown and laid reef knot. Remember that to lay the throws correctly, your hands have to cross with each throw. Ensure you make the throw above the knot and not down in your lap. With a braided suture, 3 throws are required for security, but with a monofilament, 6 throws are required. Sometimes a knot tends to slip and loosen after the first throw, for example when closing an elliptical wound. To stop this loosening, we can instead tie a double throw as we see here, and snug that down, and then return with 2 simple throws. This doesn't give a very pretty looking knot, but it is a secure surgeon's knot. Let's tie this now in slow motion. Drop your cords and watch. The short end is away from us, so we pick it up as for a coming down throw with the left hand. With the right hand, pick up the long end as though we were going to do a coming up throw. Take the long end and pass it up over the left index and middle fingers, creating a loop. Now pass the free fingers of the right hand through that same loop. By bending and straightening the middle fingers of both hands, the short and the long ends can be passed through the loop from opposite sides. The throw can now be laid correctly and snugged down. 2 more simple throws are needed to lock the knot. This time pick up the cords and follow. The short end is away from us, so we pick it up as for a coming down throw with the left hand, and with the right hand pick up the long end as though we were going to do a going up throw. Take the long end and pass it up over the left index and middle fingers to create the loop. And now pass the free fingers of your right hand through the same loop. Faculty will now check that you have the correct position. By bending and straightening both middle fingers of both hands, the short and long ends can be passed through the loop from opposite sides. The throw can now be laid correctly and snugged down, and of course 2 more simple throws are used to lock the knot. Start off in the same way as you would for a simple coming down throw. Pick up the short end and have it coming down over your fingers. Hold it over the wound and separate the ring finger from the other 2. Then hold the right hand string and pass it up over those fingers and over a second time to make a second loop. Now you can bend the middle finger, grip it between the index and middle fingers and pull the thread through both loops at once. And as you tie it down, you can see the 2 loops of the surgeon's knot. Finish off as before by a going up throw to lock it and a further coming down throw. So you've really thrown a reef knot on top of a surgeon's knot. The same principles apply when tying a reef knot with instruments. Once you've passed the needle through both sides of the wound, pull the suture through until you have a short end and a long end with the needle attached. Drop the needle. You don't need to hold it with an instrument. Place the instrument parallel and over the wound. Pass the long end around the instrument tip. Pick up the short end, rotate it through, and lay the knot correctly. Drop the short end. Bring the instrument back over the wound, pass the long end over and under the instrument again, pick up the short end, rotate it back through the loop, and drop it on the far side, having crossed your hands. Again, 3 throws of coming down and going up throws are required. To tie a surgeon's knot with an instrument, start as for a simple reef knot. But after passing the thread over and under the instrument, pass it over and under a second time to form a double loop, before picking up the short end and passing it through the double loop. When tying at depth, the throw is formed in exactly the same way as before. The difference is in the way that the knot is laid, it now having to be laid in the vertical plane as opposed to the horizontal. Let's look at that again. Pass the cord under the hook, form a coming down throw as usual, and lead the short end down on the side nearest to you with your left index finger, the tip of which passes to the bottom of the pot, so that the tension on both ends can be maintained 180 degrees apart. Now form a going up throw on the outside and lead the other end down into the depths with the tip of your right index finger on the side nearest to you. Again ensure the fingertip with the cord on it passes right to the bottom of the pot. You may wish to perform a further coming down throw. The last thing you want when you're tying deep in the pelvis is to have your tie slip off. So when you're tying at depth, it is more common to use a surgeon's knot. But we can't do that the way we first practiced, and we're going to have to do it the second, the alternative way. Start with the coming down throw, but remember we're going to go once, twice round the fingers. Bend the middle finger, grip it on the index finger, pull through the double loop. Then push down into the bottom of the pot with the left index finger beyond the knot. Then do the coming up knot, just a single throw, outside the depths, and push it down with the other index finger. Finally complete with a third throw of the coming down throw, and push down with your left index finger.